Thanks for staying with us on the South African Morning. While there could be a couple of issues with the government's proposed national health insurance, that is the warning from the private hospital group Mediclinic. The group says in its current form, the NHI is unlikely to be sustainable, raising concerns including medical aid scheme cover being eroded and the role of the private hospitals being reduced or completely eliminated. So for more on this, we're joined now by Dr. Donald Gumede from the National Healthcare Professionals Association. Dr. Donald, always a pleasure speaking to you. Let's talk a little bit about NHI right now, because from what we understand is that it says that the system will have a number of key threats to health in South Africa. In your opinion, how so?
Yeah, first and foremost, thank you for the invite. NHI is a must. Let's start from there. There's no two ways about it, because our health system is skewed. Like I listened and read through what the concerns of the private sector is. I remember these guys, they're only representing 16% of our population. So 84% still depends on the public system. So our public system is under-resourced. Hence, actually, NHI is very critical and very important. And I agree with them on few issues that I'm going to highlight quickly. The only thing that I have a gripe with, or we have a gripe with as a healthcare professional, is the power, absolute power that is given to the minister to appoint all the boards, whether it's a tariff board, whether it's the board of directors and all that. Because whether it's Dr. Gumede who becomes the Minister of Health, I would not like that power. Because you need to have balance and checks for the system to work well. Coming back to the issue that we're talking about today, the private sector, I think they're looking more into profit more than the health care of the population. Because just to show you a simple thing, in June their medical aids are exhausted. So let's say you are sick, Faith, you are in ICU, they're gonna drag you out of their private hospitals and take you to the public hospitals, which they say they're not working.
Yep.
So we need to develop the whole system instead of concentrating on one sector, which actually it doesn't serve the whole population of our country.
Yeah, but, you know, I want us to go back to the point that you were making earlier regarding the inadequate resourcing of our hospitals themselves, because now this clearly draws the lines between the haves as well as the have-nots, and private sectors are then able to capitalize, right, on those that want and are demanding the absolute best quality healthcare, which, by the way, it costs an arm and a leg to actually be able to maintain. So from one side, private healthcare is actually unsustainable in the long run because many South Africans are not affording it. But on the other side of it, we really need to do something about the jacking up of our public healthcare facilities. Is there political will? And even are there engagements with such, saying that, look, we need to be able to jack up our quality of healthcare services in the public sector, so let's work together. Are they coming to the party where government is concerned?
Wonderful. You see, the current health department budget is around 250 billion, right, somewhere there. And then NHI is going to inject a bit of muscle to try and address the three key issues that we discussed at Beechwood long time back when we were developing the NHI compact pack, which is human resource, and which is your infrastructure, and then medications and other surgeries. So unless we start and collecting the funds, there's no way that we're going to improve the hospitals or build more hospitals or employ more people in human resource or have capacity to buy medication. So whatever billions that we can collect through NHI, as long as it's managed properly, and you pointed a very crucial point, the political interference, which actually does not have the will and zeal to administer health, is actually the hamstring to the health system. And hence we made a suggestion that we must outsource the oversight of the health system to people who actually have a vested interest to make sure that the health and of our nation it's in perfect condition.
Yeah, in its current form, I mean, you were saying that you've got certain concerns about the bill in its current form. In its current form, under consultation, does it pose a threat to the general sustainability as well as the general efficiency of the healthcare system completely, whether it's private or public sector?
Yeah, I'm going to just be blunt now. The private sector is looking at their profit margins. They're not looking at improving the health. Like we said in this short conversation, their main concern is if you are sick, whether you are sick to the grave or whatever, if your funds run out, they abandon you. So it's profit for money. So that one, if they talk about threats, yes, they mean threats for them not to make money. Because majority, if you go back to the Health Market Inquiry report, majority of their money, it goes to the administrators. Because these guys are intertwined. The medical aid and the private hospitals, they are intertwined. They work together. They are owned by virtually by the same people. So they are looking at profit. They are not looking at sustainability of the health system. And mind you, just to take you through quick stats, 50% of the expenditure in health is in private hands, which represents 16% of the population. And 2% of it is from the NGOs, USAID and whatnot. So, which means only 48% of the budget, that thing, if we were to look at it holistically, it is going to the public purse, which is very little. That's why we have got doctors who are unemployed, who are sitting at home. We have got nurses who are unemployed. We don't have hospitals, which is infrastructure or capacity, because we can't build anything. So every time the budget or the Minister of Finance announces the budget, that budget cannot enable the MECs and the minister to build new hospitals. And that's why we're stagnated. We are not growing the health sector. And if we had enough injection or another injection, whether it's 25 billion from NHI, we would be able to build maybe one hospital per year, which actually is something critical and important to our healthcare system. And that will offload lots of the queues and everything that are there. And coming back to what is critical again, when NHI starts, ordinary patients will be able to see doctors, you see, in their practices. Because if I've bought into NHI, then I'm going to offload certain patients who are supposed to go to the public clinics. So actually, it's going to alleviate the burden in the public sector. We are not saying it's perfect. I mean, I'm taking it as NHI is like a baby. Let's allow the baby to sit, crawl, and start walking. It's not going to be perfect, because even themselves, when they started the private sector, maybe you don't know, they started in 98, majority of them. Prior to 1998, we were using public facilities. There were not many hospitals. There were few Mediclinic hospitals of that note, because they started in 1986 here in South Africa. There were few of them where it was working. The population didn't decline. We didn't have extremely exorbitant high mortality rate, and then when they came in, then it went down. No, it's not true. There were an augmentation of the health system. So they are not the main role players in the health system.
Yeah, I mean, Dr. Donald, to be very blunt, they're not the main role players in the healthcare system, but it looks as though they are the main beneficiaries within the healthcare system. And we're talking here about private healthcare practices. And from what you're saying, it just sounds like private healthcare is somewhat run by a bunch of cartels.
But it is. Go and check the health market inquiry. It's the truth. It's just that the problem, there's no political will to implement the health market inquiry report. And then we're sitting now, as I'm talking to you, with Section 59 report, which is being put under carpets. Nobody wants to release the report. They release the interim. It's with the commission, which actually spend lots of money. I mean, really, if it's for the benefit of the public, why don't you release the Section 59 report and merge it with the health market inquiry and make a proper health system that benefits the marginalized? Why do we still hold on to a system that is not working? The system is not working. We have enough money in the health system, but we don't have enough systems to run the health system.
Dr. Donald Gumede, we and I can talk the whole day about this one, but we'll leave it there for now. Of course, the chairperson there of the National Healthcare Professionals Council Association, giving us the latest details when it comes to the NHI bill. And of course, just a reminder, it is currently under public consultation with different stakeholders.